You're about to leave for work, and suddenly a thought grips you. Did I turn off the stove? You checked. You know you checked, but the thought won't leave. For most people, this moment passes, but for someone with obsessive-compulsive disorder, it's just the beginning. OCD isn't about being neat or organized. It's a serious mental health condition affecting roughly 2 to 3% of the global population. It's driven by two forces: obsessions, unwanted thoughts that create overwhelming anxiety, and compulsions, repetitive behaviors performed to escape that anxiety. The disorder usually surfaces during adolescence, though it can emerge at any stage of life. And while everyone's experience is unique, OCD typically falls into patterns. Let's explore 4 different worlds shaped by this condition. Meet Clark. He's an architect who can't stop counting. Walking upstairs, he counts every step. Eating dinner, he counts each bite 23 times exactly, no more, no less. If he loses count, he starts over. His world revolves around numbers and patterns that must be perfect or something terrible will happen. At least, that's what his brain tells him. Then there's Priya. After witnessing a car accident, intrusive images started invading her mind. Violent scenes, disturbing scenarios involving people she loves. Thoughts so dark she's convinced they make her dangerous. To cancel out these thoughts, she repeats positive phrases in her head, sometimes for hours, until the anxiety fades. She's exhausted, but stopping feels impossible. David's battle looks different. He's convinced that touching surfaces will make him sick, or worse, that he'll spread illness to others. He opens doors with his sleeve, avoids shaking hands, and showers 3 times before bed using a specific sequence. His hands are raw from washing. His family is worried, but the fear of contamination drowns out everything else. And finally, there's Keisha. Her apartment is filled wall to wall with newspapers, broken electronics, and plastic bags. She knows it's overwhelming, but throwing anything away triggers panic. What if I need this someday? What if discarding it causes something bad to happen? She's isolated now. People stopped visiting years ago, but the collection feels safer than the alternative. 4 people, 4 different experiences, 1 underlying pattern. So what causes OCD to take hold in some minds but not others? Genetics load the gun. Research shows OCD runs in families, with heredity accounting for roughly 40 to 50% of cases. But environment pulls the trigger. Traumatic events, chronic stress, infections, or major transitions can activate dormant vulnerabilities. Inside the brain, OCD involves specific circuits that connect the frontal cortex to deeper structures regulating emotion and habit. When these pathways malfunction, thoughts that should naturally pass instead stick like a broken record. Imagine your brain's delete button stops working. Thoughts pile up, repeating endlessly, demanding attention. That's the neurological reality of OCD. Now here's where it gets tricky. While obsessions feel involuntary, compulsions are learned and they're reinforced by relief. When David washes his hands, his anxiety drops. His brain registers this. Washing equals safety. So next time the fear appears, his brain screams, "Wash your hands," even louder. This creates a vicious cycle. Intrusive thought, anxiety spike, compulsive behavior, brief relief, then a stronger compulsion next time. The behaviors escalate. What started as washing twice becomes washing 20 times. Checking once becomes checking until your hands hurt. Life narrows. Relationships strain. Work suffers. The compulsions that once brought relief now steal hours, damage skin, and create new problems. Here's what makes OCD particularly cruel. People often suffer in silence. They're ashamed of their thoughts, convinced they're crazy or broken. They hide their rituals, fearing judgment. But these thoughts aren't chosen. They're symptoms of a medical condition. And that's the turning point, recognizing you need help. Treatment for OCD centers on a powerful approach called exposure and response prevention therapy. The concept sounds counterintuitive. Deliberately face your fears without performing the ritual. For David, this might mean touching a doorknob and not washing his hands afterwards, sitting with the discomfort until it naturally subsides. Over time, his brain learns a new truth. Anxiety decreases on its own. The compulsion isn't necessary. Medication, typically SSRIs, can help by adjusting serotonin levels and making therapy more effective. Some therapists teach cognitive techniques like recognizing this is OCD talking, not reality, and redirecting attention to meaningful activities. Recovery takes time and courage, but with proper treatment, people with OCD can reclaim their lives. If this resonates with you, whether you're experiencing these struggles or supporting someone who is, know that you're not alone. What's been your experience with OCD, either personally or in your community? Let's create a supportive conversation in the comments.